Hi everybody, how are you all? So today here we are with a topic that is a scientific method in nursing research. So when we use the scientific method in the nursing research, this will turn our clinical observation into evidence-based practice. Fine. So coming to the next, what is called as a scientific research method? The scientific research method, it is a structural and it is also a logical approach which helps to study the problems which we are seeing as a real evidence. When we are following the scientific method, this helps the nurses from identifying the clinical issues and it is giving us reliable solutions. This helps us to reduce the bias and as well as to increase our accuracy. So how it is reducing the bias? When we go for the approach systematically, this minimizes the subjective interpretations because we follow the structural and logical approach. And it also increases the accuracy. How? Since we are following the steps logically, we are coming into conclusions about or we'll be getting a conclusions in evidence based. So this will be helping to improve the patient outcomes. When we follow this scientific method with the pure scientific structural logical approach, automatically we are going to build the knowledge and this becomes a reliable foundation for our nursing practice. Okay. And next, what is the first step we have to follow under this scientific method? The first here is observation and question. See here example, ICU nurse is there. She observes the premature babies is appearing calm during skin to skin contact. So she gets a question. What's the question in her mind? Does this Gangaru care is improving the clinical outcomes in preterm infants? Fine. This becomes her observation and this becomes her question. So observation and question is notice something that needs explanation in patient care or it can be the research. So this will be forming a clear, testable question based on your observation. So as a researcher, always we have to see our question or should be very clear and it is able to test based on our observation. How here when we are providing the Gangaru care, it is increasing the clinical outcome. Fine. Coming to the next. We are having here as a second step that is background research. So now the NICU nurse, what she's going to do, she's searching for the literature. She's seeing the journal articles. She's seeing the previous studies on the topic of Gangaru care. And she learns what? Understands what is the current evidence is present about the clinical problem. That is about the comfort towards the baby. And then she identifies the gaps, find what has not been answered yet to avoid the repeating work. So the nurse discovers the reports showing Gangaru care is improving the temperature regulations and as well as heart rate stability in preterm infants. Let us see what this nurse is going to do next. The nurse now developing the hypothesis. So what is called a hypothesis? This is a prediction that can be tested and as well as it helps us to prove whether it's a wrong or whether it's a right, or it can be in the form of whether it is acceptable or it can be the rejectable. Okay, your hypothesis explains what you think will happen. So infants who receive the Gangaru care will show more stable heart rates during the painful procedures than those in incubators. Whether it is testable, yes, can be measured objectively. Whether it is specific, yes, it has a defined expected outcomes. Whether it is a feasible, yes, it can be proven wrong too, falsible. Sorry, it is a falsible. Okay, so this is a way the development of the hypothesis is taking place. Coming to the next is she's designing and also we can plan it. So decide how the test your hypothesis we are going to do. Choose our research design, choose our variables, select the sample and plan the procedure carefully. Now see here, choose the design. So here choosing randomized control trial is selected. Define the variables. Here the variable is independent kangaroo care and versus the incubator. Select the sample. She has selected 100 preterms, that is 50 for each group. What's the procedure? She is going to measure the heart rate during the heel sick. Fine. Next, collecting the data. So what to measure? Heart rate patterns during the monitors. So pain response using the standardized scale is used, and vital sign stability is done during the procedure, and also the behavioral indicators of distress is also done. So now carry out the study and collect the real measurable data using reliable validated tools. So here going with the kangaroo care versus the incubator. Fine. Now analyze your data. Use the statistics to determine the difference between the groups or meaningful or just because of the chance. So p-value is the threshold and t-test is the statistical test what we can use. So the results are statistically significant, and this t-test compares the pain scores between both the groups. So now the statistical test reveal whether the kangaroo care truly impacts the pain response or if observed difference occurred between the chances. Fine. Coming to the next, interpret the result. So kangaroo care reduces the pain responses in the preterm infants, and hypothesis is data supports the original predictions, and share findings. Publish this in the peer review journal, and NIC is going to implement this in the practice. So decide whether results support or reject your hypothesis. Then communicate the findings so the others also can apply evidence in the clinical practice. So from the observation to the evidence is called as the scientific method. So the scientific method transforms clinical observation into reliable evidence through systematic inquiry. This strengthens evidence-based practice and directly improves the patient outcomes. So this as questions, it gives ideas, it analyzes the data, and you can share the results. Fine. So you can share this with the nursing students who needs the master research in the methods, or you can use for yourself so that you will be gaining the knowledge. Thank you.